I just want to make something very clear. I'm looking for a real hug. I'm not looking for a virtual hug.
That's Mary Daniel meeting with Governor DeSantis in August of 2020. At that time, Floridians in long-term care had spent almost 6 months in COVID lockdown. Mary creating the group Caregivers for Compromise to find a way to bring in-person visits back to residents. The governor revising visitation guidelines the very next month, allowing residents to designate 2 essential caregivers.
Today, that order still remains. However, as Abby Walton shares, each new COVID wave brings fears of new restrictions and a need to make sure that this never happens again. If you remember.
Yes, absolutely, Julie and Ben. Everybody remembers this story of Mary Daniel. She went to see her husband in lockdown by taking a job as a dishwasher at his facility. Now, almost 2 years later, she's taking on a new role, talking with Florida lawmakers, hoping to turn the governor's order into law.
Hello. I'm Mary Daniel. I'm the founder of Caregivers for Compromise.
Armed with a stack of books, Mary Daniel is on a mission to tell lawmakers their story.
One book for every representative and every senator for the state of Florida. It makes me emotional. I don't know why. To show them what this looks like, to show them what happened.
By her side, one of the Big Bend's House Representatives, Jason Schoaf. Schoaf filing House Bill 987, the Essential Caregivers Bill, after hearing Mary's story and the passage of similar legislation in Texas.
As the legislature, it's our job to take these ideas and to codify them into law.
The bill allows an essential caregiver at least 2 hours of daily in-person visitation. It also allows a facility a one-time visitation suspension up to 7 days if in-person visits pose a serious health risk to residents. Some exceptions include end-of-life situations.
The governor did a great job. He jumped into action. He helped. He worked with groups like Mary, and he made it to where we could have access to our loved ones, but we shouldn't have to worry about that in the future.
For the Rogers family, that access didn't come soon enough. They lost their matriarch May, Christmas Day 2020. Her last year spent mostly at a window wondering why her daughter couldn't come inside.
Susan should have been able to focus on her mom. Instead, she was having to focus on laws and decrees, and that's not the way it should be.
While their fight is over, the Rogers want consistency for other families, worrying what happens once the governor leaves office.
What if somebody else just says, "Nah, we don't think there's any need for this"?
That fear is why Mary Ellen shared her family's story in the Caregivers for Compromise book, saying a law doesn't just give them peace of mind, but also her mother in long-term care who worries about another lockdown.
If this is placed into law, she knows that one person from her family or friends will be there every single day to see her.
But it's not just families and lawmakers in this conversation. Groups like the Florida Healthcare Association represent nursing homes across the state. While not yet taking a formal stance on the bill, they agree visitation is essential.
We understand there has to be visitation. We understand that there should be some sort of critical person, a husband, a wife, a spouse, a friend, to be able to come in at any point and see their resident or the patient, again, as long as they can safely do it.
So while lawmakers and lobbyists hammer out the details, Mary continues the mission, making sure lawmakers know real hugs are essential and visits behind glass windows can never happen again. And Julie and Ben, today this bill taking a big step forward, passing its very first hurdle, the House Finance and Facilities Subcommittee, and a unanimous vote. Now, there is also another bill regarding visitation in the Senate. That's called the No Patient Left Alone Act. This gives a broader visitation rights for both hospital patients and long-term care residents. Now, on Sunday, Governor DeSantis actually tweeting his support for a visitation rights bill here in Florida. But for caregivers, they say it really does all come down to the language, saying that hospitals and long-term care centers are both very different facilities and deserve separate protections.
Okay, Abby, so this seems like it's heading in the right direction. What's the next step?
I talked with Representative Schoaf via text today, and he tells me the bill's next stop is the Children, Families, and Seniors Committee. He's working to schedule those hearings fairly quickly. As for the other bill, he says he wants to have conversations with the other co-sponsors and see where they can find some common ground.
But as our Abby Walton recently found out, as the bill's merits are debated, families are still being kept out of facilities, some of them mere miles from the Capitol. Abby, fill us in.
All right, Julie and Ben, the past few months I have been seeing an uptick in people posting on the Caregivers for Compromise Facebook page about new visitation restrictions and growing frustrations over filing complaints with ACA. That's the state agency charged with making sure these facilities follow rules like visitation. I hadn't really seen any posts from our area, so I thought things were going pretty well until last week, when I learned no matter where you are, Florida families are still dealing with restrictions as if it were March of 2020.
They said we're going to go on quarantine.
For several weeks last month, this sign greeting people at Sedalis Tallahassee Memory Care, restricting visitors and implementing a 14-day quarantine.
They said 10 days, but then when I went to the facility, they have a big sign on the door that says 14 days. So I'm like, where did the 14 day, what are they following? And that's what frustrates me, and I think other family members, is there's a huge disconnect. The message is just not getting out.
And Lynn Robinson, whose husband Lyle is a resident there, is tired of being their teacher.
I shouldn't have to be going out and looking at the CDC rules and reading up on what our state rules are. That's what they should be doing. All the family should have to worry about is going in and visiting their loved one. That's it.
Sitting at her dining room table, Lynn goes through pictures, reminiscing about her partner of almost 50 years. Lost to a form of dementia, he no longer exists. But there's still so much love for the man in these pictures. And another lockdown means more time lost.
That connection is short. And so whenever you take that time away from me, I'm losing that. Every day I'm losing a little.
And she's lost so much already, placing Lyle in memory care at the start of the pandemic and lockdowns.
I cannot mentally do another 8 months without being able to see him.
So Lynn reached out to the Agency for Healthcare Administration, or ACA. It's their job to make sure long-term care facilities in Florida are following the rules and help when they're not. However, she says the whole process is turning into a nightmare.
Last week, I literally called every day. Every day. And you know, and so you get to the point where you're just like, I'm going to give up because I'm just not getting any answers or any response. So it's like, okay, now I've got to fight this battle by myself.
And she's not alone. Post after post on the Caregivers for Compromise Facebook page express frustration about getting nowhere when contacting ACA about visitation restrictions. To learn why this is happening, I reached out to ACA multiple times for this story via email and phone, asking Secretary Mar Stiller, who heads the agency, for an on-camera interview. Late Wednesday night, I heard back, making no mention of my interview request. I was given the following statement, saying in part, quote, "The agency will not tolerate any providers disregarding these guidelines and will review any concerns to determine if any actions are necessary." It goes on to say, complaints about facility care concerns or visitation restrictions should be reported to the agency's Complaint and Information Call Center or our online complaint form. Filing complaints through these methods allows us to properly intake and track issues occurring across the state. End quote.
What's alarming about this case to me is the burden that's being placed on the caregiver to continue this fight in the midst of 2 years of fighting. It still continues enough to significantly affect their mental health.
Mary Daniel, who founded Caregivers for Compromise, says Lynn's story is one of many highlighting the need for an essential caregiver bill in Florida.
I think the frustrating part is I don't see it any different in large corporations as I do in small mom and pop operations.
Representative Jason Shove, who authored the bill, agrees in a statement to WCTV, saying arbitrary rules are doing more harm than good. And quote, if they're going to operate and maintain a license here in Florida, they will follow Florida's laws or pack their bags, end quote. This is Abby Walton with WCTV. After talking with Lynn on Monday, I reached out to the facility's director. I gave my contact information to pass along to their corporate office, Sedalis Senior Living in Texas. About 20 minutes later, Lynn sends me this email, saying after clarification from corporate, the quarantine was being lifted, allowing Lynn that extra time. Okay, Julie and Ben, Lynn was adamant to me the entire time that we were talking that the director and staff of Sedalis Tallahassee Memory Care are incredible people and knows that they are just following corporate directives. And speaking of corporate, it's awesome That visitation got reinstated, but it should not take me as a member of the media to call them and make it happen. I still wanted to know how and where that quarantine rule came from. So I reached out to their company president, leaving multiple voicemails and emails over several days, but so far have not heard back. I'm also going to keep working to try and get you answers from ACA regarding filing and responding to your complaints. So if anybody still has visitation issues or cannot get a hold of ACA, you see my email there right there on your screen. Drop me a note so we can figure it out.
Most of the restrictions placed at the start of the pandemic were eased up until about 6 months ago when the Delta and Omicron variants emerged and changed things yet again. Our Abby Walton, who's been reporting on this throughout, says that's when some facilities started locking down again, right, Abby?
That's right, Eden. With the latest round of quarantines, they all seem to stem from assisted living and memory care facilities. That's because in terms of regulation, these run very differently than nursing homes. Now take a look at your screen here. Nursing homes are for people needing medical care on a regular basis. They do take Medicare and Medicaid. Now this subjects them to federal rules under the Centers for Medicare and Medicaid. Visitation guidelines here pretty clear cut. You basically have to find a way to make it happen. Now for assisted living, most are private self-pay facilities. Their rules come from the governor, state agencies, local health departments, and CDC guidelines. And as you'll hear, that's where things are getting pretty confusing. After window visits in 2020, Sandy Popple now spends her days with her husband Dennis inside his memory care St. Augustine Plantation in Tallahassee.
I've been there for all 3 meals for at least the last 2 months.
But those visits stopping in late January. Though both vaccinated, both tested positive for COVID-19.
I was told by 3 different people that he would be isolated for 5 days.
But on day 6, Sandy reached out to the facility and says the time frame was extended.
He'll be quarantined for 10, but you have to wait 14 before you can get back in. I said, even with a negative test, and I'm an essential caregiver, I still have to wait. And I was told, yes, that I had to wait based on their criteria.
We reached out to St. Augustine Plantation for an explanation. They gave us this statement saying in part, quote, visitation will continue to be available for all residents even if a resident is COVID positive. It adds it cannot allow visitors who tested positive within the past 14 days, acknowledging that there was initial confusion about the procedures, and they're working with staff to make sure they have current, accurate information.
With a lot of the daily functioning operations, we're looking to CDC, we're looking to ACA, we're looking to the State Department of Health or the local Department of Health, we're looking to the governor's office. And so we're trying to consider all these different sources of information to make sure that we're not overlooking something.
That's where the Florida Senior Living Association comes in, saying their group is educating facilities about the latest updates, especially if they vary slightly.
Visitation is probably one of our clearest areas. The state is open for visitation. You have to provide visitation. You're not allowed to restrict visitation unless you're talking about COVID positive or even people with the flu trying to get into the building.
After her 14 days, Sandy says she was allowed back in to visit Dennis, knowing many more families out there are still waiting. Okay, so Sandy's frustration and all of this, very understandable. In this case, the facility was following current CDC guidelines regarding COVID positive people. That 5-day guideline she was initially told is for healthcare workers who test positive. That's because after 5 days, a negative test or no symptoms, they can return to work due to staffing shortages.
Filthy socks and a filthy room. These are the conditions one woman says she found her father in last week at Reflections Memory Care in Bradenton, Florida. Kim Keston says that was the first time she'd been in her father's room since a COVID-19 quarantine stopped all visitation. While not in the Big Bend, she wanted to share with our Abby Walton how frustrating it is for Florida families to get answers about who's in charge when it comes to lockdowns. Abby.
Oh, Katie, those pictures just devastating for Kim, who tells me she is tired like so many Florida families. She is tired of keeping up with the changing rules, fighting with facilities to see their loved ones, and not getting answers from the state agency that's supposed to help them. 2021 full of videos and pictures like these for Kim and her family. Very different from the window visits a year prior.
We had pretty much full freedom up until a few weeks ago. It was like we went from full freedom to we walked in and literally couldn't take him out.
That was in late January. Kim told visitation was shutting down due to a COVID outbreak on her father's unit.
They were going to quarantine them basically for 7 days after each new case. So as soon as a resident in memory care was diagnosed with COVID, 7 days again, they had to restart their quarantine. And so it continued to happen.
From there, Kim says getting answers like a game of hot potato. The facility's executive director telling her they were following guidelines from the Manatee County Health Department.
The Manatee County Health Department has repeatedly told me they are not locking these facilities down. This is the facility choosing to do so.
We reached out to Reflections Memory Care, a family-owned company based in Illinois. In a statement to WCTV, they told us in part, quote, "We conferred with the Manatee County Health Department and decided to quarantine the community and restrict visitation for a short period of time." They go on to acknowledge the agencies they work with are not always aligned in their protocol and admit it's causing confusion. We reached out to the Manatee County Health Department for their take. In an email, they tell WCTV in part, quote, "They can only offer recommendations based on scientific findings and guidance related to COVID coming mostly from the CDC. They go on to say they can't suggest a facility locked down based on the number of COVID cases, but they cannot mandate facilities to do it." Marshall Catt, professor emeritus in FSU's Department of Geriatrics, says that's because the CDC is not a regulatory agency.
It provides advice and recommendations based on its scientific expertise, but it doesn't have any enforcement power.
Left with more questions, Kim's next stop, filing a complaint with the Agency for Healthcare Administration, or AHCA, which regulates assisted living facilities in Florida.
They told me they have 2 to 90 days to respond to our complaints.
So we reached out to AHCA Communications and its secretary, Simone Marsteller. From January 31st to February 20th, we emailed 12 times. 9 of those asking Secretary Marsteller for an on-camera interview. AHCA responded 3 times with information already available on their website.
It really is, as a family member, it's just exhausting trying to do all of this work on our end.
But after being allowed back in, seeing the condition of her father, and still not hearing anything about her complaint, last week, Kim directly emailed AHCA's secretary, who she says called her back immediately.
She did apologize and said that she would make this right.
Happy she was taking care of her father's situation, Kim says it didn't need to get to this point.
Rather than get a quicker response from our local AHCA, I had to go, higher to the Capitol, basically, and then they bounced it back to our local AHCA.
Where Kim says that office told her they were overwhelmed in cases and needed more help.
She said that 3-week response for them is actually really good. I think it's unacceptable. You see with my dad what can happen in a matter of 3 weeks.
Now, Kim says she can't move her father into a different facility because she's only an essential caregiver as his daughter and is not his legal guardian. As for those disturbing photos you saw, I did reach out to Reflections Memory Care for comment on those, and so far I have not heard back. Now, as for AHCA, Secretary Marsteller says she'll follow up with Kim once an investigation is complete. No word yet on an on-camera interview with the secretary, but as you can see behind me, we have a lot of questions for AHCA. These are just a few of the many we have regarding how the complaint process works, the number of open complaint cases they have, and how are they holding these facilities accountable.
The bill now set to head to the House floor after passing its third and final committee this afternoon. Abby was at today's committee meeting. You've been following the story now, Abby, for a very long time. What's the latest?
Well, Ben, the bill was up for a vote today, an amended version. It combines a Senate bill dealing with hospital visitation. That amended bill now creates 2 types of visitation: regular visitation, which in rare circumstances can be suspended by the governor, and that essential caregiver visitation. Now, this makes sure a resident in long-term care can always have in-person visits by at least one person no matter what. The only major stipulation here, that caregiver must abide by the facility's safety protocols. Today, Florida's Caregiver for Compromise founder Mary Daniels spoke in front of that committee about the hope this bill will give families.
That's been the hardest part about this, is that not only are we continuing to deal with the world we live in today, but then having to care for our loved one, watching them decline and continuing to have to fight to get in to be with them, and educating the staffs and educating the facilities. It would be very, very nice if we could cross that off our list and just get back to loving our family member and being with them for whatever time we may have left.
And that amended bill passing the committee today 15-2. And Ben, those two no votes coming after a discussion about a new line in the amended bill stipulating facilities cannot require visitors or essential caregivers to show proof of vaccination. Now, this hasn't been a requirement since visitation was restored in late 2020. And I'm told the reason for this is just to make sure that by law, a facility could not restrict visitation because of somebody's vaccination status. But again, Ben, everybody does have to follow those safety guidelines no matter what. A full floor vote could happen late this week.
But now, as our Abby Walton tells us, a law is heading to the governor's desk to make sure this doesn't happen again.
Absolutely, Ben and Julie. The bill, the fulfillment of a promise that this woman behind me, Mary Daniel, made to her husband, Steve, to never leave his side. Her story starting a movement, changing lives not just in Florida, but all over the country.
115 yeas, 2 nays, Mr. Speaker. Show the bill passes.
Late Wednesday night, the Florida House passing the No Patient Left Alone Act.
The relief that it's actually here is just emotional. It's been a lot of work and a long road these last 2 years.
Mary Daniel is the founder of Caregivers for Compromise, the group stemming from her story 2 years ago, taking a job as a dishwasher at her husband's memory care just so she could see him in person.
Steve is significantly declining. These last 3 days have been very, very emotional in that regard. The timing of this, as I sit, the last 3 nights I've actually had to sit with him on his bed with him and rub his back so that he could go to sleep. And he did, rubbing his back. He went to sleep the last 3 nights. And that's new. That's something that I haven't had to do before. So the significance of the touch of me being able to be there to rub his back and hold his hand is even more significant today than ever.
The bill, sponsored by North Florida Representative Jason Shove, creates 2 types of visitation in Florida. General, which in some cases can be restricted, and essential care, allowing daily in-person visits to those in long-term care no matter what.
My mother and my family's mother never has to fear that she'll be isolated again.
Mary's story inspiring families like Mary Ellen's to come together during the pandemic to advocate for their loved ones.
It's never been just about Steve and me. It's just been about all of us. And so this is really a victory for all of us, that we can work hard and we can make changes.
Now, the governor is expected to sign this bill. It'll take effect July 1st when that happens. And Mary says the next step is to follow the lead of Texas and get a constitutional amendment passed on the ballot. Once that is passed, it would make sure that every long-term care resident has the right to an essential caregiver. That way that the law can never be changed or taken away. And Ben and Julie, I think throughout this entire 2-year process, I know I've learned a lot about the system and just how long-term care, the industry works. I don't think a lot of people knew how it works. And we know right now there's a huge staffing issue in Florida. Lawmakers passing a bill recently trying to take care of that. We still have our public records request open with ACA right now to learn more about how those complaints are processed. So we're going to stick with this. And anybody out there has a story that they would like to share with us or they're having issues, please email me and we'll take a look at it.
We have an update now on Lynn and Lyle Robinson. Lyle has dementia and is a resident of Sodallas, Tallahassee Memory Care. You may recall we first introduced you to them back in February. Lynn contacting WCTV after that facility banned visitation for several weeks due to COVID restrictions that went far beyond state and federal guidance. Less than 24 hours after WCTV started looking into it, Lynn was allowed back in to see her husband.
And she says after that, life was returning back to normal. But as our Abby Walton tells us, that feeling was short-lived. Abby.
It sure was, Ben and Julie. On April 7th, Lynn reached out again frustrated after the Memory Care's parent company, Sodallas Senior Living, announced that facility and another one in Quincy would close April 25th. Their assisted living facility in Tallahassee would remain open. The reason, they say, pandemic hardships and increasing labor costs. The quick closure, though, raising flags for Lynn and us, so we started digging. And what we found was pretty upsetting. Back in Lyle's facility, Lynn sent us this video.
Can you say hi? Yeah. Good job.
But those smiles didn't last long. Lynn says in March, several longtime staff resigned.
I asked her why, and she said, I truly believe they're going to close. And I said, well, have you heard anything? And she said, well, not directly.
On March 23rd, Lynn emailed Sedalis Regional Director Dennis Knapp asking if the memory care and assisted living were going to be combined. On Friday, March 25th at 10:30 a.m., his response, quote, "Nothing official has come down." But hours after that email, the facility's executive director confirmed their suspicions.
She said, I just got word that we're closing.
That following Monday, March 28th, Lynn emailed Mr. Knapp again saying,
Imagine my surprise when I was told Friday that the memory care facility was closing. He never responded to this email.
Lynn says the Sedalis contract states if she decides to place Lyle somewhere else, she must give a 30-day written notice. And on their end,
It clearly states that they may terminate, but it's got to be 45 days, which, yeah, we didn't get 45 days.
it also says both parties must give termination notices in writing. To date, Lynn says she's never received anything in writing from Sedalis addressed to her or Lyle regarding the closure. But
When I said I never got a written letter, here's the one they sent me by email, which is not my letter.
that letter and one she received at her home in early April were both addressed to other residents and caregivers.
What got me the most is the lack of compassion and concern for the patients, for the families, and for the people that worked for them.
We emailed the Agency for Healthcare Administration, or AHCA, April 11th asking when Sedalis notified them of the closures. They're in charge of regulating Florida's long-term care facilities. Their response the next day saying the agency received no notification of closure prior to WCTV reaching out. It goes on to say, quote, "As we're now aware of the current situation, we've reached out to them in regard to the closure."
It's a big deal because closing a long-term care facility is different than closing some other kind of establishment.
Marshall Kapp of Florida State University is an expert in long-term care policy.
There actually is such a phenomenon as transfer trauma, where people suffer trauma who may not understand what's going on.
That's why he says Florida has several statutes in place to make sure AHCA is notified of a closure to help residents like Lyle prepare for the change. One regarding licensure requires a 30-day notice. The other, known as the Residents' Bill of Rights, requires a 45-day notice by the facility to residents and their families. It's the same statute in Lynn's contract with Sedalis.
You see changes of ownership with some frequency for a variety of reasons, but I just voluntarily going out of business is pretty uncommon.
Thanks for calling Sedalis Senior Living's corporate office.
Last week, we called and emailed Sedalis Senior Living several times for comment with no response. But 2 days ago, after contacting the Florida Senior Living Association, which Sedalis is a member, their president, Tracy Taylor Roberts, issued this statement, saying in part that an unfortunate misstep resulted in letters being sent to families and state regulators late, adding, quote, "We sincerely regret this and have worked hard to assist the residents and their families in transitioning to new communities." Lynn moved Lyle to a new facility in Thomasville April 7th. The transition has been tough, and she says hearing from Sedalis now is too little, too late.
I understand the bottom line. I understand a corporation's need to make money, but you supposedly are in the business of helping and caring for people. What happened to that?
Now, Lynn told me that Sedalis charged her for the 7 days Lyle was in that facility earlier this month. They later agreed to refund her that money, but she says that was only after she threatened to call a lawyer. They also agreed to comp her moving expenses. Sedalis says that refund did go out as of April 11th, but I talked to Lynn about 5 minutes ago, and she says at this point, guys, she still hasn't received that money. Now, as far as AHCA goes, with what's happening now, they can't confirm the existence of or comment about any ongoing investigations that they told me. However, it is in state statute that if a facility fails to notify them in that timely fashion, they can impose fines or sanctions. And Lynn's story, guys, not the only one. I have heard lots of other family members and staff with similar stories. If you or a loved one was at one of these facilities or worked there, take a look at your screen. These are ways you can file complaints with ACA, or if you'd like to share your story with me, you can contact me. There is all my information on our screen, or you can always go to the website wctv.tv. The story will be up there a little bit later this evening. And I think the thing for me that really just was shocking is, bottom line, these families have gone through so much the past 2 years, the staff as well. And for it to happen all this way is just really, it's just upsetting.